All right, welcome to our foot injuries and conditions lecture. We're going to go over the different foot anatomy, arches, muscles, and then how to prevent common foot injuries. So here we have an image. This is going to show you the foot and ankle. So you'll see this image again with our ankle lecture. For our foot, the main bones that we are talking about are going to be starting up with navicular and moving down toward the toes. So we have the navicular and the cuboid, our cuneiforms, metatarsals, which are going to be the long bones of our foot. We have 5 long bones, and they're labeled metatarsal 1, 2, 3, 4, 5. 1 lining up with the big toe, 5 lining up with the pinky toe. And then we, of course, have our phalanges, which, just like our fingers, those are the name of the bones in our toes. So for our phalanges, our big toe only has 2 phalange bones, and phalanges 2, 3, 4, and 5 have 3 bones in them. We also have our calcaneus, which is our heel bone, and our talus, which is a large bone that helps make up the ankle joint. Here is another image of it. It has added in some common ligaments. We won't really talk too much about ligaments for this lecture, but we will when we go over ankle sprains. This is a different view. This is if you're looking straight down at your foot. I like this view to show us a view of the long metatarsal bones. So you can see bones 1, 2, 3, 4, 5, how long they are. They make up the length of the foot, and that they line up with each phalange. All right, muscles. You guys do not need to remember all these long muscular names, but I wanted to put this here to show you how our muscles come from our lower leg and then extend all the way down into the toes. So the red muscles are the thicker portions of it. They usually start up in our knee or calf, travel all the way down the length of our lower leg, cross the ankle, and then start to change into really long, thin tendons. And that's where it turns into those white string-looking pieces. And that helps control our foot and toe movements. Okay, so prevention of foot injuries. You're going to see this list a lot when we talk about the whole lower body, because this is going to be the same way to prevent a lot of issues in the ankle, knee, hip joint as well. So number 1 would be making sure that you have proper footwear. So not just on the field or on the court, but also off of it. A lot of people are wearing shoes throughout the day that are detrimental to their form and their positioning, and that can cause a lot of injuries. We will talk about orthotics if someone needs them. Lots of times the shoe isn't custom made for that person, so we can place an orthotic in if they have an issue. Training techniques, making sure the person isn't overtraining, they're training on the correct surface, so not just running on really hard surfaces all the time, and that they aren't overtraining, overexerting, and that they're stretching afterwards, stretching before, making sure they're warmed up before they exercise. Foot assessment, we're going to follow HOPS, history, observation, palpation, and then special testing. This is what we are going to follow for all of our different joint and body anatomy assessments. Okay, so the first injury that we have is called retrocalcaneal bursitis. So we've talked about bursa before. Bursa is going to be the small fluid-filled sacs that are in all of our joints and also along some tendons. And the purpose of these sacs is to help lubricate the joint, make sure it doesn't dry out, and also protect certain parts of the bone. So as you can see in the picture on the right, we have 2 bursa. Those are those blue sacs there. The one that we're talking about here is the retrocalcaneal bursa, which is the smaller blue circle. And this is just inflammation at the bursa at the back of the heel bone, right where the Achilles tendon comes and attaches. Our next injury that we have is something called pump bump. The medical name for this is Haglund's deformity. And as you can see in the image on the left, this is where you start to get irritation and a bump starts to form on the back of the heel. That's called a bony enlargement, where the bone is actually growing outward because of all of the stress or irritation on it. So this is usually caused by shoes. As you guys can see, it's right where the back of your shoe would hit. This normally happens from people wearing the wrong shape or type of shoe, like a high heel or a really narrow tight shoe, or if it's too small. And this is where the soft tissue right near the Achilles tendon is going to become really irritated because the tendon is rubbing against the shoe. And then the picture on the bottom right, you can actually see the bony enlargement. It's that little spike coming out of the calcaneus bone and how it's pushing on the tendon in the bursa and causing that bump. We also have something called Seaver's disease. This is called calcaneal apophysitis. So apophysitis refers to when the bone starts to pull apart at the growth plate. So calcaneal apophysitis means this is happening on the calcaneus, which is our heel bone. So this is a bone injury in which the growth plate in the lower back of the heel, that's right where the Achilles tendon attaches, becomes inflamed and causes a lot of pain. This is caused by the calcaneus growing too fast, and it's growing faster than all the ligaments and tendons that are surrounding it. And because it's growing faster, there's not enough time for the length of the ligaments and tendons to stretch out and grow, so it starts pulling on that growth plate, causing lots of bone issues and a lot of pain. We have a much more common injury called a heel bruise. Even though it's less severe, it can still be very, very painful and cause people from not being able to walk or run on their foot, which means they might be held out of sports because of it. Usually it happens from landing on a hard surface, so if someone jumps or falls and lands on their heel, this could cause a heel bruise. Sometimes we will put a padding in their shoes, and we're checking their shoes to make sure that they're not too worn out, that they have proper pad in them. I've had athletes before where they're just using shoes that are too worn out, and that's caused a heel bruise because every step they're damaging their heel. And then we can use something called a heel cup, which is what this picture is. It's a more rigid, protective surface that we could put under their heel in the back of their shoe, and that way it's less pressure on their heel and helps protect it a little bit more inside their shoe. Okay, plantar fasciitis. Some of you guys may have heard of this before. It's very common, especially in running and jumping sports. The person will have pain in the anterior and medial heel at the attachment site. So we are referring to where the plantar fascia comes in and attaches on our calcaneus bone. So I'll show you some pictures on the next slide, but our plantar fascia is going to be what makes up the bottom of our foot. So it's like a strong connective tissue that helps support our arch on the bottom of our foot. So if you guys can imagine, it's supporting all of our weight all day, and then that's doubled, tripled, or quadrupled if we're walking, running, or jumping on it. Usually it's going to hurt more in the morning and improve a little bit throughout the day as it warms up. We can prevent this by stretching the arch in the Achilles really well, especially in the morning. We can use orthotics to place in the shoe, but there's also a lot of different tape jobs we can do for the arch and the Achilles to help support the plantar fascia. And then checking their shoes and cleats to make sure that they are properly supportive for them. So here we have some images. As I said before, the plantar fascia runs along the whole bottom of the foot. So this is just structural and helps maintain our arch and help support our weight. It runs from the bottom of our heel all the way up to the bottom of our toes. And the red circle on the right is showing that there's some inflammation at the attachment site. So that's right where it connects onto our calcaneus. That's usually where the person will have the most amount of pain. Okay, then this brings us to metatarsal fractures. So again, metatarsals are the long bones of the foot that line up with each of our toes, our phalanges. This is usually caused by direct force. You'll see it a lot of times in weight rooms, someone dropping a weight on their foot, or if someone falls or jumps and just lands just wrong enough, they can fracture one of their metatarsals. But it could also be a stress fracture as well. Usually the person will have pain specifically on that bone. So if you ask them where it hurts, they won't say it's radiating to their whole foot. It'll just be in one pinpoint location. And then there's a specific type of metatarsal fracture called a Jones fracture. And that's what we're looking at the image on the left with the red arrow. If you look really closely, I know it's a grainy image, but you can see a small black line, and that's depicting a crack in the bone. So that's the fracture site, and because it's on the 5th metatarsal, that's called a Jones fracture. That's just a very common place for it to break because it goes from a skinny bone to a thicker area, and we carry a lot of weight on our 5th metatarsal right there. So we are labeling it the 5th metatarsal because it lines up with our pinky bone, whereas the 1st metatarsal would be on the other side, right, lining up with our big toe. You can also have a stress fracture of this site as well. The 2nd metatarsal is very common for stress fractures, and this is called a march fracture. And that's because this happens, we see it a lot in people who are walking and marching long distances. Because marching is a very abnormal movement and there's a lot more pressure on the bones of the foot than just normal walking. We'll see this a lot with armed forces and army and military, marching miles and miles every day. We started to see a lot of people getting the same stress fracture over time in the 2nd metatarsal. This usually comes on slowly, so it's a chronic injury. Checking the shoes. If you are in the armed forces, you can't change your shoes when you're on duty, so making sure we can put in any sort of orthotics or padding if that's the case. You can do a bone scan if an x-ray will not show an initial fracture. I'll explain that a little bit more on the next slide. And then this is usually immobilized for about 4 to 6 weeks. It can resolve and hopefully not give the person any more trouble. Okay, so this is what I mean by not showing up on the initial x-ray. So we have 3 images of the same person's foot that presented with signs and symptoms of a march fracture, so a fracture of the 2nd metatarsal. The initial x-ray, all the way on the left in slide A, showed a very normal looking 2nd metatarsal. There's no cracks in it, there's no inflammation, and so they send them home. The person still has pain, they come back 4 weeks later, get a 2nd x-ray, and you can start to see where that black arrow is, that there is a little bit of cloudiness in a circular area right around the 2nd metatarsal in the middle, and that is the reaction of the stress and inflammation starting to build up. And then in the final x-ray they did 3 months later, you can really see the reaction to the stress fracture. It's bulbous, it's misshapen, and that is all of the inflammation trying to heal the bone and the bone trying to send in all the good nutrients and calcium deposits to help fix that fracture. So even though you don't see it on an x-ray, doesn't mean it's not there. We will still treat the symptoms, not just what our images will tell us. Okay, so we can also have arch strains. This is going to be on the bottom of the foot normally, but you do have several different arches of the foot. One's a long arch, one's a metatarsal arch, and this is going to be the muscular tissue that helps support the bottom of the foot along with the plantar fascia. So you can do padding, orthotics, or taping to support the arch. We do a lot of therapy trying to strengthen the really small muscles of the toes in the bottom of the foot. And then, of course, making sure someone has proper footwear that has enough arch support for them. All right, toe fractures and dislocations. These are pretty common. They normally don't pose a huge issue for athletes if it's just one fracture and not several. Lots of times we will see it on an x-ray, and then depending on what the doctor thinks, sometimes they will advise us just to buddy tape the toe to a toe next to it, and that as long as they don't have too much pain, or if we could put a tiny splint on it or tape it, then the athlete can still play. And that's just because they're small bones, they usually heal pretty quickly, and a lot of times they don't make it too uncomfortable for the athlete. Okay, then we have something called bunions. Bunion is a word describing something called exostosis on the first metatarsal. So exostosis is any kind of bony enlargement. So this could happen on the back of the heel, on the first metatarsal, but this is very common right here at the base of the first metatarsal because of the shoes that people wear. So this is going to cause malalignment of the big toe. So as you can see here, the big toe is facing outward, and that's because the bone is growing extra and it's making it come out of its normal, natural alignment. Shoe selection is usually the culprit of this, so it usually happens in older people. Maybe you've been wearing tight shoes your whole life, or people that have been wearing high heels for years and years because they have a very narrow foot and then they point the toes inward, and then that causes the first metatarsal to rub against the shoe, which in turn causes the bone to grow, which starts the cycle all over again, then makes the toe point in even more. Sometimes orthotics can help this if it's a mild case, but in more severe cases like this image, you can do a realignment